Any questions?
Sure.
Okay, I am going to do a quick physician workforce assessment presentation. Very quick, and it's draft. So I want everybody to remember this is draft. We still have 200 doctors to find. We haven't been able to find them, so we're searching those out. So these are not the final numbers for publication or anything, but I'm going to give them to you fast. They are bad, so that's why we're going to have a game to follow it up, so then we'll feel fine. So this year we have 10,227 licensed physicians in Hawaii. Most of them give their addresses on the mainland. We have 3,380 physical bodies of physicians in Hawaii. That is 100 less than we had living here practicing last year. And we have 2,889 full-time equivalents, which is 80 less than we had practicing last year. So that says to me that we had a lot of people who were part-time probably who retired or quit. In fact, 75 did retire, 8 passed away, which is unusual for us, although the last 2 years we have had a large number of deaths. We don't know if they were on the job or not. We had 112 moved out, and 75 have decreased their time. People who are in the retirement age bracket and went down to a part-time status. So we have 85 less full-time equivalents of physicians than we did in 2019. So that's the bad part. Our shortage is over 600 just looking at the basic numbers, but if you take into account the geographic differences, it's over 900. We have only 260 job openings advertised. So if you're looking for a job, go to www.ahec.hawaii.edu because we try to post them all. Or if you're trying to hire, email us and let us know and we'll post the job there. This is the graph that we show every year. We are going to get a new model for demand this year, so that may change some. Well, it should change because it's been constant for a while. But the bad news is we've gone back down to lower than the level in 2016. So this isn't a surprise. We expected it with COVID coming along, but it is still frustrating as we need to do more things to combat this. This is, again, draft, but you can see that the Big Island has gone to a 50% shortage. Move this. Where they were 42 last year, and everybody has gotten a little worse. The biggest shortages are not significantly different than they were in years past. Primary care, infectious disease, pathology, colorectal, pulmonary, allergy and immunology, thoracic surgery, and hem-onc. Some of these, as you might imagine, are extremely necessary right now with COVID. And so we are worried that people are going to be overly stressed and need to take care of themselves. As far as primary care, our shortage has grown here also. You can see the numbers. Maui County, 37% is the biggest shortage. And Big Island is 32%. So getting worse, but they do have the residency, which has helped significantly. And when we were doing the research, we call every office and ask if this physician is still working there, this many hours in this specialty. And in the process, partway through this process, we said, oh, we should ask them if COVID has impacted them, because some were saying that. 989 answered whether or not COVID had impacted them, and 42% of those said yes. The most common answers were that they had to reduce hours and that they were doing telehealth, but some of them said they've closed their practice temporarily or indefinitely. Many have reduced patient volume, some have retired, some had to increase hours to take care of the challenges, and then there were other reasons as well. What are we doing about this? This PowerPoint presentation is in the AHEC sponsor room, so you can have this one, but again, this is preliminary, so don't take it to heart completely, but We will help any student in Hawaii pursue a career in healthcare. So we want rural students, particularly disadvantaged students who wouldn't otherwise get into health professions. We will help them every step of the way. And you can go to our sponsor room and you can see some of the things that we do. The medical school is doing a great job of increasing scholarships as well as rural training. And we depend on all of you to help host our students when they're on neighbor islands, because that is one of the biggest challenges to getting them training in rural areas is finding them housing. How do we keep our doctors? This is probably the most significant thing for the folks on the phone because we are not doing a great job of this. In fact, loan repayment was not funded by the state legislature this time. When they went into session, the bill was going through, and then when they came back into session, they did not consider this bill. So we have 24 active loan repairs out of 52 total since 2012, and we are going to have to raise $200,000 to fund these 24, and that's not giving any new awards. So we may be asking you for donations. We want to start a young Dr. Hui. I've been talking about this for a while, but we now have somebody working with us who may be able to make this happen. And this bridge to practice, if you are a physician with thinking about retiring in 3 to 5 years, let me know, because we would like to get you working with medical students and residents who may be able to seamlessly take over your practice. And then, of course, we provide continuing education, such as this conference and Project ECHO, which you can go to our website and check out, or Hawaii State Rural Health Association website. We advertise all job openings on our webpage, as we said. We collaborate with the Hawaii Physicians Recruiters Group, and if anybody is a physician recruiter in Hawaii, connect them with me, because we would like to have all the physician recruiters work together to maximize our impact. We already did hire one physician recruiter, didn't work out, so we're looking to hire another physician recruiter who could work for the whole state. And if you have new providers come to neighbor islands, we offer local community members $100 to take them to lunch, show them around so they get integrated early. And how can we find enough care? So things that are going on besides the loan repayment program, we're trying to expand telehealth. Even for doctors who are on the mainland, since half of our doctors that are licensed, more than half are on the mainland, actually 2/3, we might as well ask them to do telehealth. We tried this year for general excise tax exemption, and it got as far as the loan repayment bill, and then the session stopped. And then there's a very active group of physicians here in Hawaii who've been working with Congressman Case, as well as the senators, to try and increase Medicare rates. And wouldn't that be exciting? So what can you do to help? Spread the word to students and professionals that we will help them get into school. Support student internships at your company. Fund health career advisors in schools. We are starting to go out into the schools. Now we're going out by Zoom, but eventually we will go there directly to help provide counseling, advising in health careers. And then if you want to host a health profession student, that would be great. And then if you have a chance to give the scholarships and loan repayment, that would be wonderful. And so now I am going to turn it over so we can do team battle. We heard our bad news for the day, and now we're going to hear our good news. Are you going to do that from here or over there? Okay, so these are things that we're working on doing and things we recommend to everybody we talk with. And I am going to mute myself now for almost the last time all day.